The version 3.1 release includes updates to the item reference display, an opioid treatment program, or OTP, and opioid treatment services, or OTS, assessment questions, and decision logics. Continuum items have included an 8-character code for reference. The most recent update revises the numbering system for better communication between the assessment user and technical support staff. The new numbering system also allows for identification of items derived from validated instruments, such as the Clinical Institute Narcotics Assessment, or CINA, the Clinical Institute Withdrawal Assessment for Alcohol, or CIWA, which will appear when a patient endorses past 15-day use of alcohol, barbiturates, or non-barbiturate sedatives, and the Addiction Severity Index, or ASI. Several changes have been made to the decision logic to align them with current federal regulations. Although these changes are behind the scenes, they will impact the output recommendations. The general information item now reads, has the patient been released from a penal institution in the past 6 months instead of the previous time frame of 14 days? Additionally, you will no longer see the subsection opioids in a controlled environment, as tolerance and withdrawal symptoms are no longer required for OTP admissions. The tolerance and withdrawal requirements have been revised to reflect that regulations no longer require current symptoms of tolerance and withdrawal. Instead, the algorithm requires that a patient must have met DSM-5 criteria for opioid use disorder for at least 1 year prior to admission. Some patient exceptions are updated in the decision rules since recent opioid use is no longer required for OTP admission. For pregnant patients, the decision logic has been updated to reflect current requirements of confirmed pregnancy and an active DSM-5 diagnosis of opioid use disorder. For previously treated patients, OTP readmissions no longer require that a patient be prescribed an opioid withdrawal protocol. Rather, it is sufficient for patients to have received treatment from an OTP within the past 2 years. Continuum's decision logic has been updated to reflect this change. Reflected in the summary report, the decision logic has also been updated to ensure that since OTP is a subset of opioid treatment services, all patients who meet OTP will also receive a final level of care recommendation for OTS.